actually was using telehealth maybe 4 or 5 years ago in a store and forward platform. But with the COVID-19 crisis that's going on, I actually started that on March 25th specifically. And that was due to the fact that it was actually the same day that where I live in Erie, Pennsylvania, that there was a county advisory to stay put and advising everyone to not go out unless there's urgent matters, including doctor visits. And all the while from our medical societies, we were also giving a heads up that we should consider trying to minimize our exposure to patients unless they had urgent needs, and we should try to be sensitive to patients not coming in an office and having their being exposed to the virus. So I actually went right from a full, very busy practice the week before to coming back on that Wednesday and just actually shutting down, sadly trying to shut my practice down abruptly. To the credit of my EMR system, which is Modernizing Medicine's EMA, electronic medical assistant, they actually rolled out a telederm platform, I should say, to use in response to this crisis. And so they got that out very quickly after I decided to do this in a very quick way. It's a work in progress because they're constantly doing updates. Every day they're doing some new updates, but they did it in response to the need for dermatologists to offer teledermatology. So there was a few days before I got that going on their platform where I actually was just using a free platform, which many dermatologists were doing, called Doxy.me. And that was working okay. It's not as good a quality that I'm currently doing with my platform, but it was functional. And while there was some bugs being worked out with my EMR system, some of my patients couldn't log in properly, so I would actually go back and use Doxy.me because it was a little easier for them to get onto the portal and so forth. But right now I'm pretty much 99% using the EMR system that I have in place. It starts with the front end office taking the phone call, and right now I'm down to a skeleton crew of just my wife up front, myself in the back, and my daughter who's a nurse practitioner helping me with scribing, if you will, with telederm encounters, and then for the urgent matters, doing our protocol in the office here. But when they call for an appointment, and interestingly enough, I think with all the media attention about how important it is to stay home and knowing that people are having elective hip surgeries canceled and so forth, I think people generally in my community get it. So surprisingly, my phone has not been ringing off the hooks like it typically is before the COVID-19 crisis. And I was worried about how I was going to man the phones. But when my wife answers the phone or my daughter answers the phone, and we say, we can handle this over the phone through teledermatology, or if it's even not an urgent matter, but something that's amenable to telehealth usage, we start at the phone level saying, okay, here's what we can do, here's what you need to be able to have in order to have this work. And we explain to them they have to have either, for example, a smartphone, either Android or iPhone, an iPad, or a computer. You need to have certain operating system updates up to date. You have to have internet. You have to have a computer that has webcam capabilities. You have to have stable internet, for example. And then we tell them how they can, how our system works is we send them an e-invite for this telehealth communication. The patient is then given, fortunately, some instructions. It's still not always real simple for them to follow, but they get that, and they log into the portal. They get invited to the telehealth interaction on a scheduled time. Now, many times If we schedule someone for 9 o'clock, despite this phone information, when 9 o'clock comes, it's 9:05, and nobody's logged in on the website, and we call them on the landline, and we find out what's going on. They're saying, "Oh, I'm having a hard time logging in," and it is exhausting. It's my daughter has the brunt of trying to be an IT person, trying to explain to people what a URL is that they have to sit in and how to set their password and so forth. So I have to confess, it's not easy. It has been beneficial though, in many ways, and we could talk about that. But we do have to do a lot of preparation for the patient of what to expect, and even when we think it's going to be smooth, it's not always as smooth as we'd like. I live in Erie, Pennsylvania, which, if you're familiar with the map and geography, I'm in the northwest corner of Pennsylvania, right up against the Lake Erie. And I have Ohio to my west, and I have New York to the east, and the rest of Pennsylvania to the south. I have a large draw because there's a shortage of dermatologists here. And I'd say probably I have people that actually can drive up to 2 hours away in a radius that comes to see me. And this area is probably fair to say largely older people, older population, which is challenging because, as many people know, some of them are just not that tech savvy or care to be tech savvy. Their attitude is they really don't want to. And of course, this has taken it to a whole nother level out of some people's comfort zones. Now, having said that, I am always pleasantly surprised to see some 86-year-olds who are on there, know exactly what a URL is, know how to log in, make a password, and are really savvy. I mean, it surprises me. So you can't just lump everyone in that boat, but I do have that general age population demographics. So I have city, I have suburbs, and I have rural people in my draw. Of course, not everybody has the same internet capabilities. Not everybody has the affordability of the latest, greatest iPhone with the greatest webcams and so forth. So there's that issue too. There's financial restrictions, there's age, interest restrictions, and familiarity with technology. And the other interesting thing about this COVID-19 problem is that telehealth, if we didn't have this crises going on, grandma could ask a grandson to come over and help them. But with social distancing, a lot of these people are in their apartments or their home alone, and they don't have access to family members or friends who can come lend them a hand on how to use their iPad or their computer and so forth. So it's a whole nother level, another hurdle, if you will, of being able to get people to utilize the technology. Well, I've already been on an EMR for probably 7 years or so, and I have had done previously, not through this system, but I've done on a separate platform in dermatology, something called Dermatology on Call, for a year. So that was Store 4, where people just upload images of their skin problem, and then at a later date, I can look at it, respond to those photographs, and then communicate back. So it's not real time, not live, not synchronous, but asynchronous, so to speak. So I have had familiarity with that. But when we wanted to do telehealth and virtual way of live synchronous things, I was comfortable doing the encounter like that because I've done many things electronically through webinars like this and through my organizations and so forth. What I didn't realize is the first day I was going to come in to do that is that I have like 6 or 7 workstations here in my office. And what I didn't even realize is that none of my workstations, computers were equipped with a webcam. So all of a sudden I'm like, oh my goodness, I'm here thinking at home I was practicing all weekend, all night on my laptop, which had a webcam. But then I go to the office, and the first case I'm going to do, I realized that my office computers don't have any webcams. So I had to figure out what to get on Amazon right away and wait for that. And it was back ordered and so forth, because everyone's ordering webcams now. But so that was a little bit of a thing. But overall, I'd have to say it wasn't too hard, because I have a very progressive electronic medical record company that was already in the works to get this going for us. And I've been participating in a lot of webinars. It's very interesting that I am not being very productive in the number of patients I see, but I am so busy since this has happened, because every lunch break and every dinner and evening, I've been on webinars on COVID-19 crises related webinars, whether it's sponsored just dermatology related, whether it's my accounting related, whether it's attorney related, whether it's business related. And a lot of it's not pleasant things to listen to all day long. But in terms of hurdles, to answer your question, I would say not too many, because we were ready to go and I was savvy. My hurdles was just trying to, how do you get your patients to know that this is a service that you offer? And how do you do this IT thing, which we discussed earlier? The biggest concern I had when this whole thing happened, though, I must say, was I have a backlog of maybe 4 months of patients, of a calendar that's full of patients. And I knew 3 weeks or so ago that realistically that I have to figure out how to shut my practice down, which was a very emotionally sad thing to do. And I didn't see myself being back to normal at the very earliest until June, which meant I had to cancel 600 some patients. And that was, surprisingly, there was not much resistance. I was really, my wife and I were both, and my daughter were extremely concerned about the reaction. And surprisingly, the patients have been very understanding about why we have to do that. And surprisingly, I've had some urgent things that I've had to deal with, but surprisingly not that many. But what concerns me is where I'm going to put all those displaced people once we are able to open our doors again, because the people that were already scheduled that far out are still there. And I did not reschedule the canceled patients yet, because I didn't want to have to reschedule them a second time. And most of them understand that. Once we start seeing patients again, I'll have to triage that the people that needed skin cancer surgeries, they get in first. People that had maybe cancers get in next year. I have many people, because I've been in practice for 30 years. Most of my day is spent seeing older patients that need full body skin exams, which I can't do conveniently through telehealth. And those people with skin cancer histories that I'm doing annual visits on means that I really find a lot more skin cancers. And in fact, I would probably bet I diagnosed on average 5 to 15 skin cancers a day on those routine visits. And so for every week that goes by, my biggest concern is how many skin cancers are walking around out there that I have not diagnosed. Now, fortunately, not all of them are going to be malignant melanomas or advanced squamous cell carcinomas, which are more serious. Most of them will be the basal cell carcinomas, which are not life-threatening. But nonetheless, a small percentage of those people that are being undiagnosed right now, every week that goes by, who knows what's being missed. I think, you do have to limit it a little bit to things that are focused things. In other words, I can't do screenings, as I mentioned too, but I can evaluate things like moles that are concerning, possible skin cancers that I can visualize, maybe really problematic rashes that are bothering people. I would say many of the teledermatology visits that my daughter and I deal with end up being the chief complaint is concerns over a suspicious lesion that might be cancerous. And most of the time, I've been able to reassure those people that it is not cancer. And there's been a great value and comfort with all the stress of COVID-19. There's a comfort when people are smart enough to know that something could be a cancer, and they have access to a dermatologist despite this. I think that's the biggest comfort, is to know that Telederm offers you at least some accessibility to your dermatologist in the difficult time of the crises. And so I think the reassurance that I give people who call in and show me something that they're worried about, and I can tell them with confidence that based on what I'm seeing here and the technology and the resolution, that with a great degree of confidence, I feel that that's something that is okay. Or if it's even something that needs to be monitored, I've documented in my chart what that looks like at point A in time, so that in a reasonable point B in time, if it continues to change, then I know it may have become an urgent matter, which then as an urgent matter, and that's how I phrase it to people. Sometimes I'll say, we have this situation now. Is this urgent enough to us that we need to risk having you come into the office and out of your home into an environment where there might be germs? And is it at risk to me? And we try to mutually come to a conclusion about that. And I think we've been able to successfully do that. I've also, yesterday, I diagnosed a case of Lyme disease on an elderly patient. He was really concerned because he got bit, and had a rash, and I actually didn't bring him into my office. Some of these patients, I'll evaluate them for wound checks or something. I'll actually go to their car in the parking lot. We do not want them to come in the office. Our doors are currently locked with signage on the front that explains why they're locked. And if they do have to come in the office, we have to take their temperature, give them a mask. We ask them all the obvious questions to sort out any risk. We give them gloves, and then we get them to the closest exam room possible. And then, of course, you have to disinfect when all's said and done. But I evaluated this Lyme disease case in the vestibule of my private office here. And I could see, and he brought in the tick, and the tick was engorged, and he had a rash, and I put him on antibiotics immediately. But that, had I not been able to evaluate or bring him in, and I did that first through a telehealth visit. I said, let me see what's going on first. And he showed me, I said, I got to bring him in. Probably the second case I did by Telederm was a 70-some-year-old man. And I actually saw some blisters on the teledermatology thing. And he was extremely itchy, suffering for 6 months or more, lived alone. His nephew was trying to help him with the technology. And in my visit, I saw a small blister. And in the context of that blister, of his symptoms and what I could see of his rash, it looked to be a relatively rare autoimmune blistering disease. I brought him into the office. That was considered urgent because this can be very serious blistering disease of the body. And my daughter and I did special biopsies that we, believe it or not, were able to overnight it to my expert pathology lab in dermatology in Boston. And they literally came in. I saw him at 1 o'clock. I had him come in at 1:30. I had the biopsies done. The UPS Express that ships it to Boston lab came to my door, the back door. I handed them the biopsy slips, and it was overnighted. And then 2 days later, I got the diagnosis confirmed, and we got him on appropriate medicine. So that was a great success. And had we not done that, we never would have known that was the case. And so I am seeing some things that people would have suffered or had potential harm had I not been able to have teledermatology access. That's an interesting question. I think, I don't know if there's something I wish I knew. I guess I anticipated a lot of the problems we're going to run into. I think maybe if I could tweak the question, I would say the thing that you might not realize you're getting into is how much energy and time is spent trying to explain to people how to use technology. We are trained to help people with healthcare. We're not trained to be IT people. And I'm already on a skeleton crew, and we get burned out just trying to do with what we're the crises part of medicine. And then to throw that burden of responsibility to me trying to make them learn technology is difficult. I would say that would be the thing I wasn't prepared for, how much energy and time is spent for that. I would give these thoughts. Number one is that If you have resistance to technology, just like your patients may, try to overcome that fear and get your feet wet. It's not as hard as you think to actually implement it. Number two is you must have some patience. Allow time for you to deal with the patients through telederm. We started off just blocking out one patient per half hour just to give us plenty of time to set them up, get them situated, and then give me time to document between cases. You need to talk slowly, clearly. You need to have a cadence where you don't talk over, you can't be too quick in your conversation. You have to talk, pause, let them answer while you don't talk, pause, you have to take your time to respond to everybody. You need to do the prep work. Your front end, as we discussed earlier, the front end people have to let them know what the criteria are. You need smartphones, you have certain operating systems, the most current things. You need to have adequate internet, you need to have a webcam. Then there's some camera work 101. You need to be able to explain to people about how to hold a camera, what the position with lighting and so forth. But I would say the big thing is just be patient with it, and think it through a little bit about scheduling. Start slowly would be my best advice. Don't rush into it in a big way. Start slowly.